Hello everyone, my name is Logan Jeffers and I am an MPH student. This is my presentation on the practicum experience that I had over the summer concerning the UNM Medical Scribes program, which I have been a part of for creating and building the curriculum. So a little bit of background on UNM hospital system. UNMH is the only level 1 trauma center in the state and has a nationally recognized emergency medicine residency program. The hospital serves a diverse population of people, including those from out of state needing level 1 trauma care, as well as specialty services. And UNM is also expanding its critical care services and specialties to provide even more patients. Part of that is going to be in the new hospital wing that they're building currently. Medical scribes are ancillary assistants to medical providers that primarily relieve documentation workload in real time and do essential tasks for providers that overall improve patient quality of care. The first medical scribe program began sometime in the 1990s working with paper charts. As electronic medical records, or EMRs rather, were rapidly adopted, the amount of documentation required grew, and the need for medical scribes to take on this work grew as well. The University of New Mexico Hospital first implemented the use of scribes in the emergency department in 2018, contracting with a company called Scribe America until their contract ended in 2020. Right after the pandemic, they didn't renew their contract. And a little bit of background about myself. I was a contracted employee with Scribe America working at UNM with a handful of other scribes in the Emergency Department Resuscitation Unit and Sandoval Regional Emergency Department. So my initial proposal to UNM. The story behind this is actually very interesting. After I was not working with UNM anymore, I had worked there for about a year and a half, or maybe a little bit over a year and a half, and I really liked the idea of scribes being involved in the documentation and patient care and the workload it relieved from residents, especially in the resus unit. So I proposed an in-house scribe program to UNM in late 2020, early 2021, with the intention of helping create, implement, and manage the program. I kept in touch with many providers and was persistent with my intentions of facilitating this program and getting it up and running. And after internal discussions in the UNM Department of Emergency Medicine, the goal was to start building the program in 2022, which is what is happening. A little bit of interesting fact, the graphic in this is part of my initial proposal to UNM, which I presented in late 2021. Although I had been talking with providers and talking with the chair of the department since 2020. So fortunately, I didn't start the program from zero. I consider that I started it from 0.5, jokingly, because I had a background in working with UNM as a scribe, and I also had materials that I was used to and training that I had that I could kind of tailor to the department's needs. So I was hired as a training and development specialist in late March of 2022 for the purpose of developing the training curriculum for the program, and then ultimately training the people who will be using that curriculum to learn how to be a scribe in the UNM Department of Emergency Medicine. I gathered material that I had previously used for scribing, including handbooks and online resources to help with the designing the layout and timeline of content and on-the-job training. Fortunately, this program had existed in some way and was not entirely being built from nothing. People were used to working with scribes. Most of the attending physicians had worked with scribes. The only people who had not really worked with scribes were the incoming second-year residents who are now third years. But interestingly, the third-year residents had worked with Scribes when they were an intern in their first year of residency, briefly before 2020. So right off the bat, after starting with the Department of Emergency Medicine, we surveyed the emergency department providers, including the attending physicians and residents. We assessed the workload and satisfaction of electronic charting for them, as well as their experience and opinion of working with medical scribes. Overwhelmingly, attending and resident physicians were dissatisfied with the amount of time they spent charting, and the majority of attributed barriers to charting including being too busy and having frequent interruptions or distractions. So continuing off the last slide, the majority of residents surveyed reported that they are satisfied with the amount of time and quality they have with learning from attending physicians, but also reported the barriers to their learning included being too busy and too many interruptions or distractions. So the same thing that causes problems for their amount of charting time is the same that they feel is causing problems with their learning and learning and teaching environment in the emergency department. When asked if they were scribes, if they think scribes are valuable additions to the emergency department, the response was overwhelmingly positive, especially among residents, which was not a surprise to me having worked with them in the past. So we surveyed what physicians thought was the most appropriate tasks for scribes in the emergency department to do, and they ranked this list as the most comfortable that they are with what scribes should do. So that includes documenting the patient's history, documenting the physical exam, documenting test or imaging results, procedures, consulting information, aiding with transfer paperwork, and aiding with discharge paperwork. Transfer paperwork is not common in the recess unit. Usually they're admitted into different departments or discharged. So that would be more used at SRMC, but consulting information is used constantly in the EDRU. And so that is something that I've also wanted to include in the workflow of Scribe since it was not used previously. So in developing the training curriculum, there were topics that I separated into modules. And these modules contain PowerPoint presentations that provide information on the given topics, supplemental reading material with from the Complete Medical Scribe by ABC Scribes, which is another scribe company, but it is a very good resource for what we can find. It's very comprehensive. It has a lot of graphics and diagrams and everything that we need right now, and we can potentially build our own that we can use rather than using from another resource. We can have that information in-house to provide for scribes. And also end of module quiz questions, typically 5 questions, and then we will have a cumulative exam after all the modules are done and all the training is done, just to assess their competency and their understanding. So following off of the last slide, there are 7 modules for the overall training with topics including cultural competency, HIPAA and scope of work of a scribe, emergency department and emergency department resuscitation unit workflow, history of present illness, review of systems, and starting a medical chart, past medical history, pathophysiology, physical exam, procedures and critical care, and medical decision-making, diagnosis, and medical terminology guide. We included the guide at the end as a resource, kind of like a glossary, but not, or an appendix, but not in the traditional sense. So this is a standalone thing that can be used kind of like a cheat sheet for going through quickly and seeing what medical terminology means. And there is an importance in understanding the emergency department resuscitation unit workflow. Especially, I included this because I was not taught it when I was working as a third-party contractor with UNM, and it was essential to my work. So I, in alignment with my goal of making these scribes as comfortable as possible with the health system and the emergency department system, I think it is very necessary to teach the workflow and who is who wears what, and kind of the protocols that go in place for different medical emergencies. So my thought process for developing the curriculum included three main things: exposure, innovation, and longevity. Exposure in the sense that my primary goal was and is to provide an immersive training program for scribes that ensures they are comfortable and ready for the job on day one of their independent work. This includes interspaced shadowing throughout the curriculum, which is around 2 months, depending on how fast they do it or how often. But shadowing throughout and delegating more and more tasks the more comfortable that they feel, because it's a very fast-paced environment. It is definitely unique, and it's just best to know what's going on and having that exposure rather than learning everything on paper, being told what is going to happen, and then being put into that environment that you've never been in. Even though you've heard about it, it's completely different than gradually being comfortable with it. The other part is innovation. Throughout the curriculum development, I made sure to always think about the potential for the program to be innovative and in an educational institute in an ever-changing medical billing environment. This means, so how do we communicate with billing and coding to make sure that we're doing everything that the resident or the attending or the scribe needs to do? How do we expand the scope of work to provide longevity, which feeds into longevity? Creating the Scribe program is important, but its longevity in the UNMH system is essential. This means that we need to think about new ways that scribes can do their work to ensure that if there are future technologies that take place, scribes' work of medical documentation, that scribes still have a job that is purposeful, meaningful, and essential, as well as a learning experience. But the main thing is essential, being essential. So at the beginning of the practicum, we tabled at the UNM Health Symposium, where many aspiring medical professionals go to understand the healthcare system, the different positions within health, and possible opportunities regarding different sectors of healthcare. At the beginning of the practicum, we tabled there, and I created a flyer to give out, which promoted the Scribe program. You can see that on this slide. There was an overwhelming support and interest for the program among attendees, and we ended the tabling with 2 full pages of names and contact information for people who were interested in being a scribe with UNM. So a lot of them were already scribes outside of the UNM system, and they wanted to transition to UNM. And I believe it's because UNM is such an educational environment that it is a very rich and rewarding experience, on top of the possible benefits of being able to be paid and compensated more for your work, because there is no intermediary. You're working directly with a company rather than through a third party. So in order to provide training that was based on experience, I worked in the position for which I was creating as a scribe the training so that I could make sure I was including all necessary components and ensure efficiency and support. I had worked as a scribe previously in this position in the EDRU, but I wanted to make sure that I am up to date with everything that is going on in the workflow, the standard workflow day to day, and also to brush up on my skills as a scribe so that I can remember to understand the hard work that goes into this position. It is not an easy position, and there is a lot that goes into it. So I wanted to make sure that I completely understood what I needed to train and teach and understand going forward with people who are new to the UNM system. The residents I worked with, the majority of which have never worked with Scribes, were overwhelmingly appreciative of their experience working with a Scribe. I got a lot of feedback, which was very important, and included a lot of people telling me that they don't know how they would have gotten through the shift without my help, which is a very fulfilling and rewarding experience to be acknowledged in that sense for your work. So towards the end of my practicum, we created a training video that showed a scenario of a patient with abdominal pain in order to train both scribes in what they would be doing and to show residents and attending physicians how to use a scribe efficiently and effectively. I created example charts to show what the documentation should look like based on the mock encounter, and this will be used throughout the training curriculum to provide examples and assess their learning to create a chart based off of a patient encounter. So even though during this practicum we worked on this curriculum, there's still a lot to do. The curriculum is in its draft form, and the final exam for the training curriculum is being created. So the next steps will be to hire and train one full-time and one half-time scribe to cover the EDRU shifts, and with the potential of adding more positions. Maybe, I'm hopeful, but you never know. The next phase of my work will be to train the scribes with the curriculum I developed and evaluate the effectiveness of the curriculum and improve the training based on their feedback. So COVID-19 definitely shaped the way my curriculum trained scribes to be more prideful of their work for physicians, since the post-COVID world demonstrates the hardships and struggles medical providers go through in order to ensure patient quality of care. COVID-19 was one of the reasons why UNM let go of their Scribe program and didn't renew their contract. And so I made it with the thought in mind that I want this program to continue, and I want the scribes to have an essential job that cannot be taken away by different factors like documentation improvements through AI technology, which is definitely a thing, and also providing the reason why scribes are so important to the learning teaching environment of the emergency department when it comes to attending and resident physicians learning and teaching. So for my core functions and services that were involved in my practicum, and the medical scribe program in general focus on assurance. They also focus on policy development, which is included as a core function because I have been developing the curriculum and policies of the position in the department, and we look at the different types of functions. You'll see that the assurance part is to improve and innovate through evaluation, research, and quality improvement, which is what I have implemented into the program, as well as building a diverse and skilled workforce and the policy part comes from strengthening support and mobilizing communities and partnerships, create, champion, and implement policies, plans, and laws, not necessarily laws in this case, but policies and plans, and communicating effectively to inform and educate even people within the department. My goals and objectives were for the most part accomplished. Basically all aspects of my goals, including communicating with other departments in order to build on what was already done, specifically the research department, which organically grew in a similar way to what the Scribe program is growing into now. Surveying and assessing provider satisfaction and needs for the program, talking with people about feedback and implementing changes to their training based on that. And I also used my skills in leadership and initiative to move the project along in a timely manner without much help outside of just some available resources that I had. So to review the book that I read over the practicum, Narrative Matters, Writing to Change the Health System, this book includes a series of narratives from people involved throughout different sectors of patient care and shares their story of how their experiences working in the healthcare system impacted them. The narratives throughout the book offer meaningful insight into the lives of healthcare professionals, including the good, the bad, and the ugly. I enjoyed this book because it involves everything that I've wanted to hear about diverse healthcare sectors, including innovative ways to go about primary care, different things involving healthcare professionals' struggles with their own health. These are things that I just never hear about, and I truly do value the time I spent reading it because it is so insightful. I would recommend this book to everyone interested in the healthcare system. People's perspectives and experiences are valuable and meaningful in order to work to improve healthcare systems, and it's extraordinary to go off of other people's experiences to shape yours and learn from theirs and value different aspects of what they have to share. So I highly enjoyed this book, and it is very relevant to my life right now, and there's just the things that I've been thinking about. So it just fit really well with me to read this during the summer. So the highs, the lows, and advice for future students. The highs, I was able to work independently to accomplish a goal that I've set out to achieve for several years, and it has been truly fulfilling. I felt very much appreciated by medical staff for the work I've been doing in the department, and I feel appreciated by the residents I'm doing the work with, and I feel very fulfilled in my goal that I set out several years ago, a couple years ago, to work and make this a reality. So I'm very happy that it's happening right now. I'm very grateful that I can be a part of it. The lows, really, it just is building a novel program. It's not easy, and navigating the university system is sometimes long and at times frustrating, but I've learned through other experiences and jobs that I have that this is just a process that you sometimes have to go through, where there are different ways to go about achieving things, and there's no straightforward answer, and you have to ask questions. You have to find people who have answers, and you kind of have to be persistent and in order to accomplish the things you want to accomplish, because they won't come easy, and that's a good example of life in general, but this is just in the case of large institutions. Any advice I would have for future students would be, if you apply everything you can into the work you do, people will really appreciate it and acknowledge it, since it will most likely help them as well, especially in different departments where what you're doing and the work that you're doing is relevant to their job. And always make sure to make time for yourself so you can help others. It sounds kind of cliche, but it is very important. You have to give yourself time to relax, to process things, to enjoy things, so that you can really focus on the work that you want to do. So with that, thank you so much for your time, and have a good rest of your semester, and have a good fall. Thank you.